Welcome to the Mental Edit, where we keep it real, unfiltered, and honest, because mental health is complicated. I'm Megan.
And I'm Rachel. We're here to have candid conversations about mental health, what it is, what it isn't, and everything in between.
The Mental Edit is for educational and informational purposes only. We are mental health professionals, but this podcast is not therapy, medical advice, or a substitute for professional treatment. If you're struggling, we encourage you to reach out to a licensed mental health provider. And if you're in crisis, please seek immediate help from a trusted professional or emergency services. Now, let's get into it.
Okay, welcome back. Episode 4. We are talking about anxiety.
Friend or foe?
We're going to structure this probably similarly to the depression episode, kind of breaking down different components of it, what it is, what it isn't, how we treat it. Anxiety, again, as we were talking, I learned is much more complicated than even I thought, right? So many people misunderstand anxiety, but yeah.
Anxiety clinically, to be considered an anxiety disorder, needs to be present for at least 6 months. And there are some major symptoms like muscle tightness, irritability, restlessness that we need to be feeling almost every day throughout the day. And it needs to be disturbing our relationship to self and others. So changing our thought patterns, how we behave. And again, I'm always going to say it, stage versus trait. It starts to become more of a trait in our life rather than just a stage.
Yes. And I think with the diagnosis being generalized anxiety disorder, you start to have anxiety over many different topics, right? Would you say that's fair? Okay.
I agree. And I think it's important then to talk about what the difference is between worry, stress, and then anxiety, because they are much different. Would you agree?
Yes.
Okay. So worry...
They blend for me, but yes.
They are, but I think they're also important to differentiate for patients, because when we can name something, then we can kind of bring it back. So catching, challenging, and changing the way we do a CBT. So if we can name like, oh, I'm not having anxiety, this is worry.
Okay. So let's talk about worry first.
Okay. Yeah. Worry is more what I see as thought-based, and it's future-oriented. We're thinking about something that could happen.
And it's like a nervousness.
Yes. And it's repetitive. What if I fail the test?
Ruminations.
Yeah.
Ruminations are repetitive thoughts in your brain.
What if I get sick? What if I don't perform well? A lot of the what if.
What if something happens to my mom? What if something happens to my kids? Yeah.
Very future-oriented. So there's worries, but that doesn't mean it's anxiety.
Okay.
Let's talk about stress.
Okay.
So then we'll talk about all three. So stress is very physical, and
that's like the heart racing, sweating,
and it's about
feeling motivated.
Yes.
Okay.
Something very present in the future. So an outside stressor that we're encountering right now, or something that's really taking our energy and thoughts over in the moment. So we're stressed. We're throwing a party this weekend, or
there's a lot to get done.
Yeah. Our child's in a talent show tonight. We need to make sure everything's right. Like we're stressed out. Yeah. But again, that's not anxiety.
Okay. And stress is pretty pervasive. Everybody experiences stress at some point in their life.
Yes.
Okay.
And it can be physical stress. We feel it in our bodies. Our muscles are tight. Our shoulders are up.
Yeah. Everybody always has a place where they feel it, right? I always feel it like right back here.
Yeah. I'm stressed out.
Yeah.
But again, wouldn't it be appropriate to always say I'm anxious in that moment? No, I'm just but I'm stressed.
Okay. So then how do we know it's anxiety?
Anxiety is when it is truly in us, breathing in us, in our thoughts, in us physically, and we are feeling it all the time during the day for 6 months. It's there.
Would you have specific worries?
Tell me more.
So I guess, and I do think a lot of people are going to struggle to understand the difference between worry and anxiety the way that I am. Like stress, pretty easy to get. I am struggling with understanding worry and anxiety.
So anxiety can also be like performance anxiety. How did I handle that social situation in the past?
Okay.
Or anxiety over
social situations,
our pets. So there's general worry, but anxiety is more about everything.
And like kind of a state of being where you're just, you're anxious about everything. Okay.
It's in the mind. It's the hamster on the wheel.
Okay.
Yeah.
And that is also an energy you can feel.
Yes, absolutely. In our patients.
Yes.
There are anxious patients. They usually sit on the edge of the couch.
Yes.
Up here.
Yes.
They don't take their coat off.
Yes. A lot of them don't come into the office too.
Yeah, there are telehealth patients. Yes. Yeah. We love them.
Yes.
You're seen, all of you.
And I do think sometimes there's a hesitancy here to talk about anxiety because you do feel as if when you voice something, sometimes it grows.
Mm-hmm.
So that's an interesting thing too.
Believe it or not, anxiety is our friend.
Yes.
It is there to help us. We
Can
go back to the days when we were hunting for our food and we needed anxiety to run away from the bear in order to survive. Anxiety is that built-in alarm system that's inside of us.
Fight or flight.
Yes.
Okay.
Our sympathetic nervous system. It's built in us. It's there to perform. I always say Adele doesn't get on stage and hit those high notes without a little bit of anxiety. Or in the World Series, someone's not going to hit that grand slam without a little bit of anxiety, that norepinephrine, making them show up and perform.
It's motivating.
It can be, yeah. And it can help us to prepare for things. Anxiety helps us to survive.
It's interesting because I do have a lot of clients that tell me they can't get something done or perform unless there's pressure on them. Mm-hmm. Okay.
Anxiety also gives us that heightened awareness, let's say as a new mom or new father, where we are a little more in tune with our environment with that anxiety, and it's a gift. So we can expect if that child's going to roll off the bed or off of their changing table. It helps us to think a step ahead.
Okay.
Instead of always being in that, it's really nice to just be alive mode. No, we need to perform.
So let's talk about fight or flight a little bit, because I think a lot of times with anxiety, that's what people associate those reactions with. So there's fight, flight, freeze,
and fawn.
Okay, what's fawn?
Fawn is when we just are in a stressful situation and we appease everyone around us and we comply. And let's say we are in that stressful holiday zone and we just give in to the mother-in-law, or we give in to the friend who is
an interesting one.
Yeah, who's insisting we all wear matching pajamas. So we're just going to do it.
Okay. So that is, to me, I always say there's some clients I'm like, oh, I wouldn't have known you were anxious. Maybe they're the fawns. I call them the ducks that are swimming and then their feet are really flopping like this.
Yes, underneath the water. Yes. Yeah.
Okay.
So you're anxious. You're not just a people pleaser. It's making you uncomfortable. But yeah, so that's the fawn.
Okay. So fight, flight, and freeze. This is where anxiety is productive and motivating, because sometimes those options, right, are helpful.
Yeah, okay, absolutely. Anxiety can help with ambition. A certain level of anxiety can fuel ambition. And I wouldn't even say that's fight or flight. I think the flight part is escape and avoidance.
Yeah.
When we just totally go into task paralysis mode if we're worried about giving a speech. Okay. Where we just don't do it and we hide under our blanket all that weekend. That's escape and avoidance. That's the flight. I'm going to go back to what you said with dehydration and hangxiety, the anxiety we feel after a hangover.
Oh, yeah.
So a night out of drinking, we're dehydrated. Our blood pressure is a little bit lower. We need to compensate, so our heart rate goes up. So we physically feel from that heart rate that we are anxious. We're also nauseous. There might be some remorse over what we did or said the night before if we remember it. And then we get this hangxiety. And then I see at times that does lead into a generalized anxiety disorder.
Interesting.
Yeah. So hydrating is really important to kind of break those episodes. Drink your water. But it's also important to name it. Is this anxiety or is this anxiety? But anxiety is very real too. I see it in my patients.
Yes. And it's worth saying that if you're experiencing high levels of anxiety, take a look at your drinking habits.
Absolutely. Yeah. Are we disassociating?
Okay. So let's talk about anxiety in men versus women.
Okay.
I think women, I'll say it, are pretty classic with anxiety, right? Externalized worries, concerns, checking behavior notes. The mom, did you get home okay? Did you get home okay? Like those kind of like pervasive worrying, anxiety, stress around, it's usually your family members or the job or what's going to happen or how they look or that kind of thing. That's, pretty classic presentation of anxiety.
What I see in an anxious woman is they try to overexert themselves in every situation because it gives them a false sense of control. So whether if it's their child's hair, what their child's wearing, or how clean their kitchen is, or is their desk perfect, that's not OCD, OCPD, that's anxiety.
Interesting.
This woman needs to fake herself into she is in control so she thinks she can lessen that anxiety.
It's funny you say that about the overachieving, because when I have a client, it depends. I have to feel them out. But sometimes when they come in and identify as type A, I say, oh, well, type A actually just means anxiety.
Absolutely.
And we share a little laugh. And actually they when I nail it, they're like, oh yeah, that's true.
I always know I'm anxious because I start to scrub my shower a lot more.
Yeah.
And I have a very clean bathroom. And I'm like, oh,
yeah.
I'm facing something that's giving me some anxiety.
Yes. Or you do like the rage clean, as I call it, where like all of a sudden you're looking around your house, you're like, everything needs to go back in its spot.
Absolutely. Yes. Or even in an anxious social situation, I will put more effort into how I appear, how I look, because I can control that at the very least.
And sometimes have a beverage before you go, which is always a key indicator of your level of anxiety. Right?
Very good. Yeah. Our litmus test is, again, dissociation. Are you having that drink before you go out to chill?
Yeah.
Chill your mind.
Yeah. And then with men are tricky with anxiety. I think they are much less prone to take it on.
I think they're much less prone to vocalizing it.
Yeah.
But they are also, it's in their blood, anxiety, because they were the hunters to perform well under anxiety, men.
Okay.
So there's more of that on
maybe it's less crippling for them, so to speak.
Yes. Okay. In a nature sense, it is within a guy to be able to handle that level of anxiety because he is the provider and had to hunt the food.
Okay.
So what I see in men with anxiety is anger and irritability. And that's when I ask my road rage question. They will also become very avoidant, men, to atmospheres and situations that give them anxiety.
Yeah. And I think men can be less flexible. And you can notice like a lot of question asking that's usually an indicator for anxiety.
The need for reassurance.
Yeah. Treating anxiety, what actually helps? I'm going to go hard for CBT, cognitive behavioral therapy, because anxiety is so thought-based. It's so important to identify all these different worries, anxiety, stressors you have so that you can catch them. You can put, what I like to tell my clients is like, put some space between your thoughts and yourself, right? Then you can control your emotional reactions to these thoughts, right? You have a thought come in, sometimes you just have an instant emotional reaction to it. So how can we create space there between the thought and the feeling, right?
That is challenge, change.
Yeah, that's sort of the core of CBT.
Or as we said, catch, challenge, and edit, and being able to catch those thoughts so when they appear, we can name them.
Yeah.
There's something you brought up real fast that I want to touch on. You talked about the reaction or response.
Yes.
And the difference between being response-oriented and reactionary.
Okay.
So when a patient is reactionary in a situation, usually they're anxious and they're in that fight mode, let's say in a confrontation with their partner. And when they're reactionary, they're going to be emotion-based and impulsive and speak their mind. What comes after reactions is like this emotional hangover. When we're response-oriented, we take that step away and we're more thought-based in our response back. And that's how we can show some control in how we approach anxiety. Really wanting to take that step aside, bring in catch, challenge, and change, catch this thought, and then give that response back.
And that's why also, with the responsive reaction thing, you sort of have to learn how to calm your nervous system down. So I can throw out all the coping skills for this. Emotional regulation, that
square breathing.
Yes. But you tell me what works for you.
Yeah.
You try some things, right? We can practice in the office if you want. And then you tell me what works for you and then do that. I always tell people not to sound like a therapist, but a real deep breath does wonders for your body. Like,
absolutely. Yeah.
Or sometimes especially when you're inside for too long, I said, just go outside and take a deep breath.
It's going to physically ground you. Even putting your hands on the ground. You're at a stressful family party. Go outside, put your hands on the ground.
I always tell my clients, if you're up for it, put your hand on your chest. It feels so nice to feel cared for even by yourself.
I love that.
Yeah, it works.
So that's where the mindfulness meditation comes in.
Yeah.
Then exposure therapies is, if this is a prolonged anxiety, let's put our feet in the water and give it a try and realize that we can do this. So if it is driving over that bridge, maybe let's start by being the passenger who drives over that bridge.
Yeah.
And then if we are to drive over the bridge with someone else as the passenger, and maybe a couple weeks from then we're ready to do it on our own.
Exposure therapy is typically done with, or can be done with a therapist. So that's kind of like a subspecialty. I've found requires a high motivation from the client too.
Yes, agreed. Because it can be comfortable to be set in these anxious ways because they provide us immediate relief to not do the challenging task or engage with it.
Yeah. So what about medication?
I love medication. I also think that it should not be first line for anxiety.
Interesting. I didn't know that.
Unless we need to try therapy first.
Okay.
Unless we're in a situation where this is becoming debilitating, or let's say it's an anxious mom or a postpartum mom who's having postpartum anxiety, we need to bring on a tool.
Well, and that's
medication.
Where the hormones come into play big time too.
Also, yes, absolutely. But let's make sure that we are being conservative in our care. And if this has been going on for a while and that patient is like, I can't even go to therapy with this level of anxiety. Okay, well then let's also bring on medication as a tool so you can start therapy for these anxieties and talk them out.
Can you tell me why you prescribe antidepressants for anxiety?
So you're probably mentioning the category of like SSRI or
yes.
SNRI. There's other medications too. Yeah, they are FDA approved for anxiety.
Okay.
I say SSRI, selective serotonin reuptake inhibitor. The way I phrase serotonin to my patients is serenity. So it's kind of a coverall when we go to an SSRI. So if it's depressive-ish symptoms, anxiety-ish symptoms, adjustment disorder-ish symptoms, then an SSRI would be a great medication to start. Can it take time also to start working? Yes, absolutely. It can take 4 to 6 weeks, which is also why therapy is so important, because we don't want to be in the waiting game of just sitting in distress tolerance for 6 weeks as this medication maybe starts to work, which is pretty frustrating with medicine. There are some medicines that do work immediately, and those would be the benzodiazepines, Xanax, Ativan, Valium, Librium. I'm trying to think of what ones, Klonopin, skipping over a bunch, but they are helpful. I stand by them. Do they have that risk for addiction, tolerance, and dependency? Yes, it's important that we acknowledge that, but that does not make them bad medications.
Okay. They're just not a long-term solution.
Right dose, right person for the right right dose, right person for the right reasons by the right person, then it is appropriate. And long term,
you should put that on a bumper sticker. And I think when you facilitate a open, trusting relationship, your client will not lie about their use of certain meds, especially if you educate them around exactly what you want them to do with that, which I know you do with your clients.
I do. And they're so tightly controlled by the government. Yeah. So there's a level of transparency there with use and filling script that can't be avoided. The other important medications, I mean, we can even use low dose antipsychotics. I hate that name. I call them dopamine modulators because there's so much more treatment with them than antipsychotics. But like a low dose, for example, Seroquel, that's very helpful. Okay. And that can help with sleep and anxiety at bedtime. And then there's also beta blockers, which are cardiac medications. We're calling them right now performance enhancers.
Yes.
So they can help with times of stress with public speaking, or
I know a lot of actors, performers take them before they go on.
Yeah. And it was shared with me that most recently in professional golf, they were banned because if a patient is anxious and shaking, it can take away that tremor. So your putt is more refined. So professional golfers, so I heard, can no longer take beta blockers such as propranolol.
Interesting.
Yeah. But those don't make you sedated the way that something like a benzodiazepine can.
Okay. Let's talk about lifestyle strategies. Yeah. So in addition to therapy, I do look at a patient's, I'll have them run down their day. How much sleep are you getting? What are you eating?
Water.
Water? Yes. When is your last, how much caffeine are you drinking? How much alcohol? It's like, are you moving through your day from caffeine straight to alcohol, that kind of thing?
Nicotine.
Yeah.
Nicotine is so available right now with these vapes and people who are putting the pouches in, whether they're Zins or Ons, there's a lot of nicotine in them, and that's going to put you naturally into a fight or flight mode of that sympathetic nervous system.
Yeah, and I think, when we identify, yes, a patient hasn't been sleeping very well or prioritizing their sleep, that just sort of exacerbates a lot of anxiety symptoms.
So anxiety, I think we talk about it more like, oh, it's something new. It's this modern problem.
Oh, yeah.
It's not.
No, yeah.
Anxiety has been around since forever. We talk about it more now. We're more vocal about it. I think that we share more about our anxiety, but I think that the awareness overall of anxiety has just increased.
Yeah. And perhaps the, awareness around differentiating between, worry, stress, and anxiety, right? There's more awareness around that.
Yeah,
So,
absolutely.
it's interesting when we talk, sorry to go on a little side thing. It's interesting when we talk about, is this stuff just more and more now? It's like, no, we're just much more educated and aware of it, right? A lot of our parents, and even beyond that, just buried all this stuff and suffered. Whereas
and are still suffering.
Yes, by the way, they still are. But whereas, I would say the millennial generation and beyond, we're drawing this up to the surface. The problem is sometimes we don't know what to do with it.
Yeah. I think the only other angle to take to that is the contributing factor of technology and anxiety. It's undeniable. So yes,
You're going on your phone thing again.
Going on your phone, you get your immediate dopamine hit. You're comparing yourself to others. You're reading the news. We have computers at our fingertips 24/7, for better or for worse.
Yeah. And, while it is, arguably good to know about what's going around the world, what I sometimes say to clients who are kind of lost in it is like, it is very hard to know about atrocities around the world and have nothing to do about it, right? We all care, we all feel bad, but we can't take action. And, that's just a hard way to live.
Yeah. So put the phones down.
Put the phones down.
Put news limits on your phones.
Yeah. I do tell people you can take in 10 to 15 minutes of news a day and still be informed. And just because you limit the amount of news you're taking in doesn't mean you don't care.
Yeah. Okay. One more question.
That was my soapbox.
I love it. Do you think that avoidance enables anxiety?
Yes.
Yeah.
Okay.
Absolutely. Because we're just pretending like there's not a problem when there is one.
Yeah.
And it's going to continue to grow.
Yeah.
So one of my
you mean by avoidance, you mean kind of like dismissing that you're anxious?
Dismissing that you're anxious and dismissing the trigger.
Okay. Avoiding the triggers for your anxiety. Yes. Okay.
Yeah.
Now
So if we're avoiding the triggers, then we are just avoiding the problem.
It's funny because I was telling you, I see this a lot with kids.
Mm-hmm.
When we notice a kid has a fear of something, a lot of parents tell them to avoid it or help them even subconsciously avoid this thing versus more of an exposure therapy, which is so low stakes at that age, right? You can teach them resilience, moving past anxiety or fear of something. Usually it's just an initial fear, right? Through some work and coaching with them, you can move past it so it doesn't become anxiety.
Yeah.
Thank you for listening. Make sure to subscribe to The Mental Edit and turn on notifications so you never miss an episode. Give this video a like if you found it helpful and drop a comment with your thoughts or questions. We want to hear from you. You can also DM us on Instagram at The Mental Edit with topics you'd love for us to cover. And if this episode spoke to you, share it with someone who needs to hear it. No fluff, no BS, just real talk about what healing actually looks like.